Welcome and good afternoon, everyone. My name is Colin Welker. I'm a senior policy analyst here at the Public Health Law Center, and I just want to say you are all in for a treat to hear from CoCo and John about working with tribal communities in the state of New York. We're going to kick it off with CoCo, but just want to acknowledge that CoCo is the Deputy Director of the American Indian Cancer Foundation and has been doing this work for a long time. So I hope you are all tuned in and ready to hear her talk about this issue. So you are up, CoCo.
All right. Thank you so much, Stephanie and Colin. Thank you for the opportunity to be here with all of you today. I'm super excited to co-present along John and really just talking about how we do this work in tribal communities. I know we are focusing on working with tribal communities in New York State. I will share with you all what I've been taught and what I've learned along the way, and how, I think the most important thing is in doing any work with tribal communities, understanding that every tribal community is unique. So please just know that as I'm sharing through this, it is what I know, but I don't know everything for every tribe, and we'll kind of get into that. So before we get started, I just want to introduce myself. Chaze mitawa, enisakumaki makiapi tobeko akwa enwati. Like Colin shared, my name is CoCo Villaluz. I work with the American Indian Cancer Foundation. I am based on the Fort Peck Reservation in the Northeast Montana, where it is pretty chilly right now. And I'm just so happy to be here with you all. As we talk about this, I really want to acknowledge where we're going, what we're doing. As part of this work, in any of the work that we do, we like to acknowledge our ancestors and where we've come to where we are and where we're going. And this picture on the left-hand side is a little girl that I found, in doing some of my research, that I've never met. I don't know her name, but then the image in the middle is actually my daughter. And as my mom was making her regalia, and I seen this, it's just like it was so similar. And I think it's just so important to honor, those who have fought for us to be here, and to where we're going. And again, this is another image of my daughter, just, thinking about the future generations. So often in our work, when we work within tribal communities, we approach it from a very circular, holistic manner. So everything that we're doing today is going to have an impact on those, in the next 7 generations. And so I just always like to use this slide of where we're doing. Now, a lot of times you all might hear, right, this ancestral land acknowledgement. It's become quite popular. But for us, no matter where we're going and no matter where we're traveling, we are always grateful to be on the land that we're in. And so, where I'm at in Montana, this is where some of my ancestors come from. But really, what this means, who were traditionally here. And so, wherever you're tuning in from, I encourage you all to check out this website, the Native Land .ca, and learn more about the people of the lands that you reside on and really what this means, thinking about the traditional names of those communities. So for example, I live in on the Fort Peck Reservation. We have it's known as the Assiniboine and Sioux tribes. However, when you dig deeper and go back to some of our elders, the true names for the tribes are Dakota, um, as well as Nakona. So there's just, really understanding the language, the context, and what that all entails when you're living and residing within any community. And I really want to note that so even as a Native person, when I travel, for example, if I'm going to New York, I want to learn more about those communities. I want to visit with the elders, community leaders, the young people, and to know, because when I go to those lands, I'm a visitor. And it's really important for me to learn, understand, the rich history that is there and it continues to exist. We're not talking about hundreds of years. They're still living, breathing, and thriving in those communities. So I think it's just always important to understand what that means, learn more about what that means, and understanding that. So The work that I do, I'm with the American Indian Cancer Foundation. We're a national nonprofit that was established back in 2009 with American Indian leaders, elders, and community members to really address the cancer inequities our relatives are faced with. We partner with and support tribes as well as urban Indian health programs throughout the country to provide education and improve access to prevention, early detection, as well as treatment and survivor support. And so, when you're talking about cancer, you really cannot talk about, you have to include, right, tobacco, traditional tobacco, how that is a part of our communities. Our overall mission is to envision is really we see a world where cancer is no longer a leading cause of death. And we know that so often that Native people have the highest disparities in rates of commercial tobacco use, cancer, where we see the cancer continuum decreasing in most communities. However, it's the opposite. You see a rise. And so we've really focused our work on culturally appropriate messaging, and that when we use our culturally based solutions, that we have the wisdom to be able to hopefully reverse those high rates and really focus on thriving. So I want to kind of take you on this journey, like I mentioned at the beginning. We know that there have been a lot of historical events and acts in health that have attributed to our high rates. And so often this work, right? We know smoking is bad. We know eating, unhealthy food is bad. But why do we still do it? Why are there such high rates? And it's important to know that this historic framework of events from, the first, kind of impact of when colonization started to happen, that, from forcibly removing Native people from their ancestral lands by suppressing our cultural practices, the US government really created conditions that continue to negatively impact our communities. And so, like I mentioned, what happens 7 generations from now is a repercussion of things that have happened, since the 1400s. So I'm going to kind of dive deeper into a little bit of these pieces. This is the Declaration of Independence, the founding document of this country. However, when we look at it as Native people, this document states, right, all men are created equal, but as well as hypocritically proclaim that American Indians are merciless Indian savages. So the original inhabitants of this land that we're on, that is our original home base, this is what the founding document of this country based on. So you could see that we pulled it out a little bit there. So, it does make a difference, right? Like if this is our traditional homelands, but this is how we're seen, and this document is still standing. Also, another important act to recognize is the Dawes Act of 1887. And the objective of this act was to assimilate Native people into mainstream US society by annihilating both our cultural and social traditions, excuse me. As a result of this Dawes Act, over 90 million acres of tribal land were stripped from Native people and sold to non-natives. And so again, when this is your home and you're being forcibly removed from your home, where you're not able to hunt or gather, plant, that makes an impact on our overall health outcomes. This are images from the boarding school era, and the boarding school era was something where children were forcibly removed from their families and from their homelands and taken to become more westernized. And so the government at this time really prided themselves on taking these before and after images of our young people. And so here's an image, a few images of the children before to this moment. And the motto of the boarding school era was to kill the Indian, save the man. So if you take a moment to look at that, now this was just, over 100 years ago. We still have members of our families and our communities who are boarding school survivors. This image is from the Carlisle Indian Boarding School in Pennsylvania. And as you could see from the previous image to this image now, that, they're not wearing their traditional regalia, their hair is cut, they're wearing these uniforms. And the whole concept was really to strip the identity, like it says, to kill the Indian and save the man. There are so many horrific stories. I was just in Alaska this past summer and hearing some of the elders who serve on National Healing Boarding School, who I just want to acknowledge and honor the things that they had to do for survival, right? People needed to be able to survive, and so they, did what they had to do. So often, a product of these schools were, physical, mental, emotional, as well as sexual abuse within these communities. And so a lot of our relatives are still healing from that. Just a couple months ago, three of these young babies who could be have been in this picture, their remains were identified and they were brought back home into our home communities. And so we had to have a ceremony for them and be able to bring them back home. But they had not been home since 1834. So can you imagine like living here in Montana, your babies being taken from their homes from, the ages as young as 3 and 4, taken all the way across the country, being thrown into this environment, and to never see their families again. And so there is, repatriation where we're bringing our community members back home and having that. And so, we're in the year 2024 and this is happening in the 1800s. So it's still very alive in our communities and a part, again, of why we may see higher rates of smoking and coping, because there's still a lot of healing that is happening. And, a big piece that we wanted to talk about today is tribal sovereignty and what that means. And, there's over 574 federally recognized tribes. There's also tribes who are still fighting for state recognition. And I think it's still kind of ironic, right, that these are our original homelands and we're still fighting for our rights, and, what we know. At the core, the essence of tribal sovereignty is the ability to govern and to protect and enhance the health, safety, and welfare of tribal citizens within tribal territories. Tribal governments maintain the power to determine their own governance structures and enforce laws through, the tribal courts, the police departments. We have the self-governance to make decisions about our community's laws, customs, and policies. This really includes control over cultural, economic, and social matters that are specific to each individual tribe. And so when we look at tribal sovereignty, essentially it is that our communities, like for example, we have a chairperson. That chairperson is essentially the president of their own nation. And so it's really important when you're working within tribal communities, knowing that there are their own separate government and they have their own rights and laws and what that looks like. Tribal sovereignty is, I think about it when we're doing our work in communities, that they really have, the way to make policies, systems, environmental changes happen in the way that they need to have it happen. I get excited about tribal sovereignty because, we look at it from this perspective too, that um, we just it's a beautiful thing because of how culture exists in our communities, how we have relationships with land, how we have those relationships with water and wildlife, as well as, just the court systems. And so, tribal sovereignty can be its own course in itself, and we could talk about this for days. But when you're working within commercial tobacco control, traditional tobacco, it's important to understand how we have these types of conversations with the tribal governments, the councils, with the community members, and understanding that within these tribal governments and communities, that cultural, ceremonial leaders have just as much pull and weight, as within the tribal government, as well as the Western, kind of component. So we'll kind of dive into those a little bit, here in a bit. Also, acknowledging social determinants of health are all things that are in our environment that impact our health. These are circumstances that we're born in, the communities that we grow up in, and the healthcare systems. And so I just like to point out, so like I always mention, I'm in Montana. It takes me 5 hours to go to a mall. It takes me 2 hours to go to a Walmart, right? And so when we even like are trying to get access to go to a clinic, or even getting different types of screenings that we need, or even getting access to, fresh produce. It might take a little while. It might take things, and there's a lot of myths that all Native people have. We don't pay taxes. We have free access to insurance. All of these different things, and those are all kind of part of the government treaties that again hold different conversations. But that's not always the case, right? And again, creating access. And so things such as, the Dawes Act, such as, boarding school era, we are still suffering from the impact. And then I just want to share, during COVID, there was a company that was sending food boxes to tribal reservations. And so these food boxes, we're not even sure. It said meat. It said like taco meat. I'm not even sure if it was really food. Not even the dogs would eat it. But these were still like things that they're giving out to our communities. So these all, again, impact our overall health care. And so it's just a pie chart that like when we're looking at things within our control, the behaviors that impact our health, these fall within 30% of the categories. But we know that there's all kind of other underlying factors that play a role. So when we think about health, what is health? A state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. So that ideally, right, like that is something that, is important. When we look within tribal communities, we kind of operate, there's a medicine wheel. I don't have that image here, but we really focus on the mental, spiritual, physical, and emotional. And when we look at, just even in doing this work, and this is not even just within tribal communities, I'm sure many of you have seen this image. If I could see all of you right now, and I'd ask you to raise your hand, how many of you have seen this image where we're talking about equality, equity, and reality? But I take a step back and look at this image and I'm like, why are they still standing outside of the fence? Right? Like, do we even want to be at this ball game? Why aren't we in this, this kind of overall structure of, sitting in the stadiums? Again, it's just like we're still standing out the fence. I just have so many questions about this image, and how we approach our work in any community. Um, so when we think about commercial tobacco's impact, right? We know all of you who are in public health, who are in commercial tobacco control, that this is the leading cause of preventable death and disease, that over 500,000 of Americans die. Approximately 16 million Americans suffer from smoking related illnesses. I'm sure if I asked every one of you, right, we know somebody who've been impacted. But I know things are changing and I know that'll be part of the discussion. Vaping's coming, right? And so I'm a mom of four. I asked my kids, like, do you guys see people smoking? Because like when I was growing up across the street from the high school, it was known as the cancer corner because that's where all the kids would go and smoke their cigarettes. But now it's like vaping and like all the undercover devices. So I know the commercial tobacco's impact is still there, but we're also combating other issues and competing priorities. But it's still important to address this work. As a whole, as we mentioned, the US has seen commercial tobacco use rates decrease, but that's not realized in all of the communities that are listed above. And so, the inconsistent adoption and enforcement of different policies, different, in secondhand smoke exposure and support for cessation. And so just realizing that we've done a lot of work. I want to say that we should be proud of the work and how far we've come, but there's still a lot of work to do, especially within like the Native communities. In my community, I go to different gatherings and there's still a lot of secondhand smoke exposure. And it's something that we're constantly working to educate on. So just some facts that, cigarette smoking is more common in American Indian, Alaska Native than almost any other racial group. American Indian, Alaska Native people have higher risk of tobacco-related disease and death due to higher rates of cigarette smoking and other commercial tobacco use. That cardiovascular disease is, leading cause. And I'm not here to doom and gloom, guys. These are just the facts that we're working with, within our communities. And how diabetes is also, tied to that and, just has higher rates. I wanted to bring up a paper that we worked on, with two of my colleagues from our former organization, Clearway, Minnesota, that we took a deep dive into the tobacco industry documents library. And when we were searching, we know that the tobacco industry targets, community members in many different ways. And that's what we were kind of expecting to find when we were researching around American Indian Alaska Natives. However, we found it to be reversed, how the tobacco industry really took a look at the original origins of traditional tobacco and used it as a way to romanticize and to sell their products. And so these are just some of the findings and quotes that were, listed in the tobacco industry document library, how they used it to bond people with America's origins. Also, that they found that this was a quote from the American Tobacco Company that the first Americans to smoke were Indians. It's time they took back the credit for inventing the cigarette and got back to the country the cowboys took away. So these are just examples of the tobacco industry pieces. And then on the lower left-hand image, you'll see that they're selling sage smudge sticks, with your commercial tobacco products. Like if you want to pack a cigarette, you could also get ceremonial incense or even get teachings from, a book of elders. So again, just all of the tobacco industry tactics, how they are always, looking, they have so many resources to be able to look into the communities that they're working with and market it, in ways to sell to the community. And, when we ask people a lot of the times, have they seen some of these tobacco products? Some people think it's traditional tobacco, which is, what they want, when we know it has the same additives as other commercial tobacco products. And so, we found many ads that, specifically from the Natural American Spirit, that they continue to emphasize, the fascination with American Indian culture and trying to draw that connection between, the traditional sacred use. So these are just examples from our findings. We do have a paper that we could share if you guys are interested in reading more about this study. So really, like that was kind of like my doom and gloom, like acknowledging history, right? It's really important because it's not just history, it's still a lot of current realities. However, a lot of our tribal community advocates and partners are reclaiming traditional tobacco because it wasn't until the American Indian Religious Freedom Act in 1978 when that was passed. So that's not that long ago. That was only 46 years ago, where Native people were allowed to hold and carry their medicines and practice their cultural ways out in the open without the fear of going to jail and other pieces. So we really, at the American Indian Cancer Foundation, utilize a culturally based framework that involves holistic health. We support healthy lifestyles. This was just an example of, addressing diabetes risk. We really look to our plants and our medicines and our cultural teachings to be able to create change in our communities. So we use the two tobacco ways that we adapted from the Blackfeet Nation and Lori Newbreast, who worked with her community ceremonial leaders, cultural leaders, to really make that distinction where traditional tobacco use honors the creator. It's governed by cultural protocols for spiritual, ceremonial, and cultural uses. So that looks very different from commercial tobacco that we know, such as, cigarettes, chewing tobacco, and all of the other emerging products. And so this image that you see here was actually grown outside our house this summer. It's a beautiful, vibrant, lively plant that we only utilize for, cultural purposes. My children grow this plant, and when they're ready to harvest it, they use it for, different cultural ways, such as when they're just, waking up and being grateful for a new day, they will make a tobacco offering to the water, to their favorite tree, or when they're asking an elder for a prayer, they'll go and offer that tobacco to them. And so that's what these tobacco plants are used. Again, acknowledging every tribal community is different. Even within families, people use it in a different way. This image is, again, I use my kids a lot in these PowerPoints because I'm proud of them. They're working really hard to carry the tradition on, because, just not my mom's generation, but her parents' generation, they weren't allowed. And so my baby's growing. This is their plants. They carry it with the utmost respect. They sing to them, they talk to them because it is a living being. It is something that is so special, that we just would not go throw it in any way. We make sure that we follow the protocols that we were gifted, to be able to carry this out. The image on the right is the red willow, which is the chinchasha for us in the northern plains. We utilize the inner bark of this plant as our medicine, and we're only allowed to collect these during certain times. And so when you're working with the tribes in any community, and I know like in New York, oh, there's some amazing cultural leaders who have their creation stories of like how tobacco came to them. There's just, winter time is a time too where a lot of times tribal communities, that's only the only time when their stories can be shared. So I encourage you all, if there's an event that you see happening within a tribal community, go and learn and listen and visit, because that's where a lot of the rich stories and protocols and traditions will be shared. Sometimes, also just note that not all traditions and protocols can be shared. There are certain, ways in, instructions on these things, and a lot of times, you're not allowed to bring cameras. Like, before social media age, the different era. Now everybody always has a phone in their hand and recording. We don't record our ceremonies. That is most of the time prohibited because that is a sacred time between our communities as well as with the creator. And so just always again being mindful, being respectful. If you're not sure, ask. Most of the time it's always okay to ask. And so thinking about this work, whether you are partnering with a tribal community, whether you're a funder, what has worked in their communities. We know that evidence-based versus practice-based, it might look a little bit different, but a lot of, I think about those seeds that we were just talking about, that my children grew. Those seeds held on through all of the assimilation tactics, through the genocide being forced. Those seeds held on and are reemerging themselves. And so we think about those practice based that it has survived and what that looks in our communities. Most of the time, we're all working towards similar goals. We might just be approaching it in different ways. And that's really important within our tribal communities. This image here, we were in the Suquamish Nation earlier on this summer, and part of the cultural protocols and teaching was going out on the water and going out on the canoe. And that is very specific to that community, how protocols and traditions come. For us in our community, when the first frost hits, that's a time for us to go and be able to do some of our ceremonies, or when the first lightning hits. And there's a whole other discussion on climate change because now we got to really pay attention to the seasons. This past summer we had two growing seasons because the frost had come early and we started to harvest our plants, and then all of a sudden the weather warmed up and then we had a second growth of our traditional tobacco. And we're like, okay, so we're learning too as we go. But when you're working with your communities, understanding, things might look a little different. And, just asking. So often we use scare tactics, and we've done a lot of focus groups, message testing, key informants. And so often the reflection from those was we want to see, honor and culture. We want to see intergenerational approaches. People know that they're not supposed to use, smoke or vape, but again, it's coping mechanisms. And so when we're able to address the healing, we really think that they'll be able to have a change. Um, and language matters, like inclusion of generations, inclusion of language when you're working towards any type of PSC change. Being creative in this thinking. In Minnesota, we worked with the state health departments to be able to support the growing of traditional tobacco. We supported tribes to be able to purchase canoes to go harvest their traditional tobacco along the riverbanks. And that's huge because again, community solutions look different. And so the overall outcomes remain the same, right? We want improved engagement and effectiveness. We want to show that policies are happening, that we're reducing the commercial tobacco use rates, that we're seeing cancer rates go down. But we really need to focus on community-based cultural programming initiatives and tailoring them into the communities. And so when I think about language in our community, when we pass the second ever comprehensive commercial tobacco-free ordinance. We didn't say it was the no smoking ordinance. We didn't say we're gonna ever never do like World No Tobacco Day. Like those look a little different in our communities. We called our ordinance the Keep Tobacco Sacred Ordinance, which translated into Ohini Chandiwa Khandapi Shaniwa Khankanuza, which took me almost 6 years to be able to translate those words, to get community consensus. I literally knocked on 5,000 doors to visit with our community because I wanted to ensure we had input, that it was inclusive, and what that would mean. Because our cultures are oral tradition, even how that looked. And so that is very true to many tribal communities in how we approach the work. Within this work, collaboration is important. We are really the seeds of our ancestors. Please note that so many tribes and community members, we plant, carry, honor, cultivate, grow, know, heal, harvest, and connect with our traditional medicines. Not only tobacco, our sage, sweetgrass, and again, all tribes have their own medicines. And it's just really important to acknowledge those pieces. When working within our community, we understand the need to assess our ways of life. We look at it from a very indigenous worldview of understanding the world, that things are in a circle, that our life waves are rooted in culture, that we find balance, that we respect all living things, and just the different components. There's an image, the black, red, yellow, and white quadrant, that is the concept of the medicine wheel. And our whole goal is that we're leaving a legacy better for our young people than how we got to it. And so this is just a model that we've created when we're working within our communities. These are just examples that we see, community tobacco gardens, that we see ceremonial grounds, that are, open for smudging. Because so often we start, like, if I was with all of you in person, we would most likely start with a tobacco ceremony. We would do a smudging to just, clear the space out. And so oftentimes in a lot of buildings, we're not able to smudge and use our traditional medicines. And that is really important when we're having our gatherings. And so we love to have people come to our communities to visit with us, to share a meal with us, because we're able to do these in our spaces. And so these are just examples with some of the communities that we worked with of like their vision for healthy, thriving communities around eating as well as traditional tobacco. So as I mentioned, I worked for an organization. We were a life limited nonprofit set up during the master settlement times. The state of Minnesota had their own agreement. And our organization, we had an initiative called the Tribal Tobacco Education and Policy Initiative. And when we started working with the tribes, we had released a request for proposals, and nobody lined up to like sign up, like, hey, we want this funding. Because when they read our request, they didn't necessarily see it as a fit for them. So we took a step back. We worked with, consultants to go out and do community interviews with the tribes to show what they wanted to work on in their communities to be able to effectively create change. And so this was, kind of our framework. It's centered around being able to do, three buckets of education, policy, as well as organizing and building support. So at the core of it was restoring traditional and sacred tobacco use. That was kind of the foundation for doing any of the work. And then, making sure people were educated within the staff in the communities, creating policies around, smoke-free spaces, and knowing that informal policies had just enough as much impact as formal policies within communities. So again, the little p, big P in what that looks like, as well as reducing tobacco industry marketing. So often, that, and here that tribes sell, commercial tobacco products for discounted rates. Again, there's so much more context that goes into that. Tribes do, what they need to do. A lot of times, these smoke shops have generated economic revenue to create infrastructure that supports education, that also provides, health. So it's a very complex conversation. We will never speak against tribes for what they're doing to try to provide better outcomes, for their communities. But it is important to acknowledge, and that was something that our tribal community partners wanted to understand is like, if this is the direction, is there a way to be able to provide tobacco tax revenue back into preventative measures? Or is there a way to create smoke-free spaces within these? Or, do we not sell commercial tobacco products? Again, very complex. That is up to the tribal communities, but we really want to continue this education so people have it, because, like I said, all of that historical trauma and, that's led into today, there's just still a lot of education that's happening, as well as the businesses and casinos going smoke free. I know anytime we talk about, smoke free spaces, casinos come up. Again, more complex conversations. We do have advocates working tirelessly to try to create smoke-free spaces. We had two tribal communities in Minnesota who actually worked hand in hand with their casinos to do the monitoring, the indoor air monitoring, to be able to hopefully take their casinos smoke-free. There was a paper written about that. It's more scientific, and we could share that as well. One tribe chose to not have any of their information because they wanted to use it for their internal, kind of conversations. So we really worked on, respecting the tribes' way, whether it was around data sovereignty, whether it was around just all of these components. And we really utilized a comprehensive approach where we had evaluation, we had a research project, we partnered with different organizations, both statewide and nationally. We had a mentor who provided one-on-one type of consulting. We had a collaborative training and TA model. We worked with the National Native Networks. We had billboard campaigns. So all of this was so essential in creating change. And these are just examples, and I'm going to kind of go through this because I want to hear all the great work that John is doing here. These was just more kind of in depth of some of the components that we did as part of this comprehensive model. But at the core, when you're working with tribal communities, it's so important to include members from beginning to end in part of this movement. We really call it a movement. And that, when we were working on billboard media campaigns, when we were working on research papers or just different peer-reviewed articles, that our partners were at the core of it, guiding us and teaching us how to be able to do this work. We also created a report. You might have seen this. It floats around the web. Recommendations when working, respecting sovereignty, funding long-term community-generated strategies, placing value on, tribal insights. I won't read all of these to you, but I really encourage you all to read this report and look at some of this. And what I presented on today really kind of highlights these recommendations and how we've approached this work. Our board had even at Clearway, Minnesota, had even went through a whole series with Native Americans in philanthropy to be able to teach a deep dive in history around American Indian Alaska Native issues for us to be better funders in this work and better partners in this work to ensure that we were supporting tribes to do this work in a meaningful, authentic, and engaging way. And so with that, I just want to share that, when you're doing this work in any community, especially, in New York, gosh, New York, like a lot of the tribes, like I said, they have such beautiful creation stories. And this mural was done because in the tribes in Minnesota, those creation stories really help to guide the overall work in the community. And so that's just something that, I really encourage, and I cannot emphasize that enough in going into the communities and meeting with people. And I know sometimes it can be, right, a little bit nerve-wracking because we don't know what we don't know, right? And but that's the part. It takes time to build trust. It takes time to build relationships, but you'll see, right? We're all trying to move in a good way, and we can do that together because we're stronger together. So with that, I just wanted to say, Panamaya, these are, tobacco is alive, it's thriving. When you're doing work in your community, if you could see behind my virtual background of the water, I have all of our medicines here. um and it's going to continue, where we have a legacy. And so when you're thinking about this work, even utilizing the terms as tobacco free, or like I said, the World No Tobacco Day, when you're working with tribal communities, that will not be the case. Our world will never be tobacco free. We do want to get rid of all the commercial tobacco products, but understanding that sometimes we're still using some of those products for cultural purposes because of the access, and we're still reclaiming ways. So we're still, we're taking baby steps towards the good work, but there's still a lot of work to do, and we're here to help support people in this journey. And there's no wrong question. We want to have these kind of dialogues. We want to have these questions, and understanding that, our children, these seeds that are, growing here, are still here, and they're still going to be going. So with that, thank you for your time, and I'm going to turn it over to John.
Well, I wish I would have pictures of my dogs now, because now seeing your little girl is, I think that's an unfair advantage, but um great job as usual. I love when CoCo presents, because then I can take notes and it helps. I can build on what she's already said. The one thing I wanted to show real quick, I don't have slides, but I have some different websites that. So the first thing CoCo talked about was the nativeland.ca. This is what the website looks like, and this is what New York State looks like when we're talking about different tribal groups throughout New York State. My coworker and I were down in the lower part of New York State right here. And CoCo will probably yell at me because I'm not going to say this right, but it's Haudenosaunee is the group that we have in our area, which is the Seneca Nation. What I wanted to go through real quick, mostly because I'm trained as a history teacher, but then secondly, when you work with Native groups, and CoCo talked about this, knowing the historical background of the groups you're working with, helping you realize the trauma that has gone on, but also the issues of why it can take so long to build that trust, because it is work to do. You're constantly doing it, but there's definitely a reason behind that. So I just read this article Sunday, and it talks about, mostly, I would guess, if I could see everybody, the same thing that CoCo said, how many people have ever seen this photo of the gentleman on top of the big pile of bison skulls? And when I was in school, we were taught that the American bison was shot and killed because of the Transcontinental Railroad and expansion. And honestly, when you look at historical documents now, it was the eradication of the American bison was a way to also completely control the Plains Native Americans, whose culture centered around the American buffalo or bison. And what they were trying to do is, by killing off the American bison, gaining control of these native groups, and pretty much forcing them onto reservations that were designated for them. And so, this is back in the 1800s. At the point, the American bison, the estimated between 30 and 60 million. And then by 1889, when this eradication started, we were down to 456 American bison. So when we talk about trauma and we talk about mistrust by certain groups, there was a policy that we tried to eradicate a whole species of animals to control a group of people. And when you think of that, like, why that mistrust is built up over time and historical trauma. And then for us, where we have the Seneca Nation, the Kinzu Dam was built in the 1960s. So we're not even talking about that long ago that this historical trauma and this displacement of people happened. And when the Kinzu Dam was built, it took over 9,000 acres from the Seneca Nation and displaced over 700 Seneca members to different parts of their territory. So when we talk about history, when we talk about broken treaties, we're not even talking about that long ago. The 1960s, some of these groups have faced issues. And then as we keep going here, I put this out because we're in tobacco control. So the one thing you have to realize for some native populations is that commercial tobacco is an economic driver. And it's not, I'm sure if you asked the Seneca Nation, do you want to be in the cigarette business or would you rather be in some form of other business? I'm sure they would pick something else. But when you have a group who's been placed somewhere, told this is your territory now, survival is definitely key. So we may not like it, but commercial tobacco for some groups is an economic driver. Not just it creates jobs, it creates business. So we have to wrap our mind around that when you're working with native groups. And this is like CoCo mentioned, language. Language is very important because the policies we're trying to pass could impact their economy. So I have a long history with the Seneca Nation and commercial tobacco. When I was in college, both my parents smoked before that, but when I was in college, I worked for a Pepsi distributor and used to deliver to all of the smoke shops on the Seneca Nation when internet sales happened. And when you're talking about an economic driver, we would go to a little smoke shop with maybe 8 employees working at their computers, yet every week they were buying $3,000 to $5,000 worth of pop and beverages for their employees. So when we talk about an economic driver, it's large scale. So in 2003, the ban of internet cigarette sales really started to bring down how many smoke shops were on the Seneca Nation. At the peak, I would say there was probably 50 to 75 smoke shops across the Seneca Nation, which is actually for us in our catchment area, and there's 3 different territories. And then we talk about cigarette taxes. So in 2011, wholesalers were not allowed to sell non-taxed major brand cigarettes to native retailers. And then as we keep going, we get a little forward here. In 2022, New York is one of 3 other states that this has to do with gambling pact. Next slide is where I want to go to. The gambling pact that they have, the Seneca Nation with the state. Governor Hochul actually froze the Seneca banking establishments, halting all payments and money transferring to get money that, depending on the gambling compact and the idea. What's really interesting about this freezing of the Seneca Nation's accounts, if you look down here and it's highlighted. So they owed $564 million, and then $418 million of that was turned around and gave to the Buffalo Bills for their new stadium. And then, so now we get into 2022, Unmarked Burial Site Protection Act. New York State is just one of 3 states that has no protection for native remains that could be found, and no protocol in place of what has to happen. So when we talk about, and I'll stop sharing now, when we talk about the historical trauma and the issues with sovereign nations and federal law, state law, it is an ongoing situation. So we have to be cognizant of that and aware of that to start out. And like CoCo says, we don't know what we don't know until we ask. So you do have to have some you're in some uncomfortable situations sometimes, but it's okay. The one thing I've learned with participating with stuff going on at the Seneca Nation, it is a lot of, for us, sit and listen and learn and take it in. The one thing I realized for us, and I think this is why Colin asked me to be on this, is talking to the young people that I work with in Reality Check. It was very evident to me that the only thing that our young people know about the Seneca Nation is that's a place you can get cheap tobacco products, weed, and you can gamble. And I find that very sad when we talk about learning about different cultural groups, especially since we have a very interesting historical cultural group right in our backyard that has an awesome cultural center. We talk about all the time knowing the difference between we work on commercial tobacco. As CoCo said, for some groups, tobacco will always exist. And for young people to realize the difference between commercial tobacco, and you can call it traditional, you can call it sacred, you can call it ceremonial tobacco. And what I really learned just a couple weeks ago, one of our co-workers at Roswell Park Cancer Institute, who is Seneca, she works in the Indigenous Cancer Center. She came up to me at a community event, and she goes, I love that when you talk to people, you use the term commercial tobacco and sacred tobacco. But for the Seneca Nation, we don't use the term sacred tobacco. We use the term ceremonial tobacco. And I said, oh, I did not know that. Thank you for telling me. But when we're working with certain populations, we want to use the language and the terms that they use. That's just showing simple respect. So that's one of those things that you hear, you file away, and you start using that stuff. So for when we work around now the Seneca Nation with the Seneca Nation, I'll always use the term ceremonial tobacco. So what I wanted to put together to start building this, not just the knowledge base of our young people, but also using this opportunity to invite our state and county elected officials, because the one thing that you realize when you have a native territory is when you try to pass policy, every elected official loves to point the finger of why not to pass policy, because it does not affect, for us, the Seneca Nation, because they're a sovereign nation. And they love to point out that, the Seneca Nation is why we have higher smoking rates, higher vaping rates. Now, with legalized adult use cannabis, that's going to be the next thing. But we have to build the knowledge base of, you can't blame a native group for problems that happen outside of their territory. And so we contacted CoCo, Dana Isabella, who's on the other side of New York State, who has the St. Regis Mohawk in her catchment area, to take this opportunity to work with CoCo at the American Indian Cancer Foundation, and then another group, Clinton Isham at Reclaim Sacred Tobacco, and start really building the knowledge base, historical, but then commercial versus ceremonial tobacco. We are working with someone locally with the Seneca Nation to tie in what CoCo pretty much went through with us with historical, and then relating that to the Seneca Nation, to build that awareness of our kids and our elected officials. I'm looking at the clock. I see we have 5 minutes. I know Colin wants time for questions, but you really you have to, when you're working with Native groups, you have to show up. The thing is, I learned at CADCA this year at a grant writing symposium with Native groups is and the lady said this, so I feel safe saying this. There is a real thing called Indian time. And the idea is it will, for Native groups, it will happen when it happens. Which for some of us is frustrating because we want stuff to happen quickly, but we just have to build those relationships. You have to step outside your comfort zone and be a resource and be a partner when you can be a partner. We've even worked with like their youth bureau for Earth Day, cleaning up their Pennsy trails through their community. So you just have to find out where you fit.
Great job. Thank you, CoCo and John. Don't forget, if there's questions, you can put them in the Q&A box and we'll monitor those. And if you have something you think of later, we can follow up via email with those as well. Thank you so much for sharing both of your wisdom and knowledge about this topic. And I think to me, you both really hit it home that just showing up is so important, and taking the time to learn and educate yourself and your respective communities about about these issues is really, really important. I see CoCo sharing some links in the chat, so I would be sure to check those out. John as well. We also have a resource we'll put in the chat about working with tribal communities in the state of New York that encompasses some of what some of what CoCo shared with us today. I just wanted to ask, I know we're close on time, but CoCo, John, to both of you, if you could give advice to folks, community folks working in the state of New York that want to work with tribes. I know you've talked about showing up, but is there anything else that you would advise the grantees in the state of New York to do if they want to start working with tribal communities?
The one thing I would say, and I've heard from people in tobacco control, but people also out of tobacco control, that Native territories are unsafe places to go. You know, and because I've done store observations in our native stores, and you just have to get over that feeling. They are a group of people like anyone else who wants to have a healthy future and a healthy community that they live in, and you just have to get past it. And there are times where I've been the only Caucasian person in a meeting, and yeah, I realize it, you know, but being there is the important part, and trying to help in any way you can for what they're trying to accomplish. To me, you have to take that step. That's all I would say.
Yeah, I would just say, yeah, I mean, the most important thing, I laugh because I was like, I feel safer on my res than when I leave like my res. So, you know, I think it just comes back down to, right, like we're all doing the best that we can. We're all like, don't be scared. I think there are such beautiful, thriving communities that exist. You know, I really like just check out calendars, social media. There's so many things that like you could see what's going on. Powwows are a really fun place. Again, every community is different. I only been to a few places in New York, and it's just been so wonderful and welcoming. And so again, it's just like having that conversation. Like, you know, it is. I cannot emphasize that enough. You know, just getting to know people, and I think that will really make a difference. And John, I really appreciate you sharing the bison picture because that's one of our traditional food sources. And here in Fort Peck, we actually, through this cooperative with other tribal communities, we have some of the genetically pure bison from pre-contact that is part of our cultural herd, because that's so important. And that's part of the lifeways. It's connected to tobacco. And I know we're out of time, but I would love one day to share some buffalo tobacco stories with you all.
Thank you, Coco. And again, thank you, John. And thanks for everyone joining us today. Um, we have one more question, if you guys can stay on for a moment, from an attendee that just is asking, what can be done better by New York State and local officials when it comes to working with tribes?
So, and I know we have some Bureau of Tobacco Control representatives on here. So I've been in tobacco control in New York State now for 13 years. When I first started, we were told the Seneca Nation is you can't do anything there or try to do anything there, which for me, who've lived in this area my whole life, and like I said, I worked at Pepsi, I saw the business side of commercial tobacco and what it meant for that community. I'm like, but how are we going to make an impact in our community then if we're not focused on everybody? Now that has changed. I honestly, I think and Ken and I have had this conversation because our group is called Tobacco Free Chautauqua, Cattaraugus, Allegheny. For certain groups, as CoCo has said, tobacco is going to be we're never going to be, not everybody's going to be tobacco free. So wording, how do we approach groups when the name of our group already is like, yeah, no, that's part of who we are, you know. So we've tried to look at that and thrown some different stuff around of how we're going to rename ourselves in the next 5 years to make us more, be more inclusive. For me, I'm on the American Indian Cancer Foundation newsletter, Reclaim Sacred Tobacco, Next Legends. To me, sending the one thing I've realized is that sending them resources when we get it, SAMHSA sends out stuff and CDC grants for indigenous groups. OASIS sends out stuff, which is the Office of Addiction Services. Just sending that stuff to the contacts that we have so they're aware of it, it is huge. And that's like our Drop the Vape campaign. I really wanted a representative, especially for our youth initiation of that, of someone who was or is Native, because showing them, just showing that we care. You're part of our community. We care about you. You're not on the outside. And when we have drug-free communities or coalition meetings, making sure someone from these Native groups know about these meetings and invite them to be part of them, to me is a huge thing.
Yeah, I would definitely echo that. I know within a lot of the reports and just, interviews that we've done, it is the representation, hiring more community members to work alongside. I mean, even my role when I was at Clearway, I was hired on to be able to, have the conversations and really try to be able to like translate between the worlds. I thought that was really important. Ensuring that when you're mentioning ceremonial tobacco, like that was really important for John to share, is like, this is what this one community likes to acknowledge. Having all of that, I mean, I don't think that can be emphasized enough. And if you've heard me present before, you probably hear a lot of the same things, because there's so many people who still are not aware about traditional tobacco or, sacred, however it wants to be mentioned in the community. And when all of these big dialogues and discussions, ensuring that there's representative voices, not just from tribal communities, I'm saying all communities, because I think that's just a whole other issue, right? In doing this work with the community, is that representation. And that's what we've heard over and over again, is having somebody that looks, knows, or even thinks like them. Because even like within like quit lines that we created within Minnesota, we kind of created a master's level type of training program when working with the quit line coaches. So when people call, they understand all of the nuances in between. And so those are very necessary steps, I feel, in working within tribal communities from a statewide level, local level, any type of level.
Thank you both so much. I think that's a great place to end on. again, I appreciate both of you taking the time to share with the folks in New York your insights and knowledge about working with tribal communities around commercial tobacco control and celebrating ceremonial tobacco. Thank you both. Thank you, everyone. Bye-bye.